Hi, everybody, and welcome back to Sam's Healing Podcast. My name is Sam. I'm so glad that you've joined me today. And today I have the pleasure of interviewing two really smart human beings today that are very involved in helping people heal. The first one is a guest you've seen quite often on my podcast. Her name is Amanda Esproni. Amanda, thanks for coming back in.
Good to be back.
Next is Chris, who is a PhD trained neuroscientist. But Chris, why don't you take a couple of minutes, and we don't have you on camera, just to protect your identity and safety. Why don't you share a little bit about your credentials and background?
Sure, and great to join both of you. As you said, I'm a trained neuroscientist. I studied biochemistry and psychology in college and was always fascinated both by how the brain worked from a psychological perspective, and was really interested in understanding how the biology leads to psychology. And so the best way of doing that, in my mind, was to try to do it via direct study in neuroscience. So I did a PhD graduate program in neuroscience where I studied the molecular mechanisms of specific stress peptides, so how it changes what goes on in individual cells in the brain. And subsequently, I'm no longer a bench scientist, but I still work in the broader novel therapeutic development space, working with companies to help them develop novel medicines, both in the neuroscience space and in other disease areas.
So really smart person, and really enjoy the big words. Thank you for that. I'll look some of them up later and see how they apply to me. I'm just kidding. But Amanda, you are heavily involved and have been for quite some time on treating PTSD, but also complex PTSD, and not just for betrayal trauma, for also childhood sexual abuse survivors. So what launched you into that world?
What launched me into that world is my own personal experiences with all of it and the team of clinicians. I mean, everything from neuroscientists to general practitioners to specialists to doctors helping me on my own recovery journey, and then going to school to become a clinician as well.
Fantastic. So, Chris, I want to ask you a question. We talked off camera about the enigmatic, if you will, or mysterious way psychotropics work to treat anxiety and depression, as well as what Amanda alluded to, PTSD, complex PTSD. For the listening and viewing audience, can you share more about why psychotropics are so effective for trauma, obviously including complex PTSD and PTSD?
It's a great question, and I'll try to give the best answer I can. The short of it is, I'm not entirely sure we know. One of the things in the study of therapeutics and mechanisms of stress and other psychological issues is that it's rarely as simple as there's an imbalance of a neurotransmitter, or there's this one molecule that's doing something wrong, or this one part of the brain that is doing something wrong. I mean, psychology and human behavior is incredibly complex and involves oftentimes the whole brain and various parts of the brain. And so really trying to understand for those diseases that are characterized by very complex behaviors, what exactly is driving it, and then how exactly drugs work to treat it is difficult. So one of the things I think that I've observed is that some of the most effective treatments we have for psychological disorders are literal hammers, not literal, but figurative hammers to the brain. We know, for instance, that electroconvulsive therapy, which looks brutal, actually is incredibly efficacious at getting people out of severe states of depression. And that's literally inducing a seizure in the patient's brain. Now, there's side effects. There's memory issues that occur in the time around the treatment, but you're literally giving someone a seizure to shock their brain out of the kind of state that it's in and get them into a new state that can allow them to move forward in a healthier manner. My suspicion is that psychedelics work probably the same way. And the reason they're being tested for trauma is not because somebody in a laboratory was fiddling around with neurons in a dish and applied a psychedelic and figured out exactly how it's affecting that neuron. It was likely from observations that individuals who were experimenting recreationally with psychedelics were able to, it's well known that they get your brain into kind of a different state of perception. And there's something about that shift in brain state that seems to be beneficial for folks with trauma and that have gone through other stressful events. And I think where the work is right now is how can we refine those psychotropics that people use, and how can we tweak them so that we get all of the benefits of them as medicine without any of the side effects or drawbacks. So it's work in progress, but it's fascinating that they do seem to work quite well for some people.
No, you used the key word right there. It is fascinating to hear about it. I've had several clients do it, and they have absolutely loved it. And so, Amanda, do you suggest in your caseload that your practice rather, that you're unfaithful or betrayed, consider the use of psychotropics, and why does it help them in, as you see the treatment kind of take shape for them?
Yeah. So if I have clients coming in and they're presenting with high levels of obsessive compulsive rumination, or what we refer to as, triggering and flooding states, and they have high levels of depression, and they have a lot of cognitive rigidity, we cannot get their minds, like to what Chris said, to move into any kind of altered state of perception. I think that's kind of how he said it. So if that's happening, and we're using all of the tools in our toolbox outside of psychotropics, then that's when I start talking about psychotropics. But it's scary for people because of what Chris said. They don't understand what is happening to their brain. They don't understand why it's working, and they don't understand if it's going to work or possibly make it worse.
And is it fair that some of those clients might actually need to be educated on how they are actually being cognitively rigid?
Yes. So understanding that, and I don't know, Chris, if you can speak to this, but I know you and I have talked off camera about understanding the damage done to the brain for your animals that are under high stress or chronic stress situations. So being able to say to the client, the way that you are reacting after the fact because of all of the traumatic events, like you have had brain damage done to your brain. How do we know this? Because not all people develop and present the way that you're presenting. I think they say the rate of PTSD, say people who were exposed to September 11th in New York City, 30%. Okay, so that's a big percentage that doesn't develop PTSD. Okay, so your response doesn't have to be this way. So we want to try to use these other interventions to try to move you out of it into more healing. Chris, explain. Go ahead.
No, I was just going to agree because I was going to use the parallel. I don't know the data for the psychotropics or whether it exists, but I'm pretty sure in depression, for instance, or anxiety, that they're, cognitive, whatever type of sort of talk therapy you want to use in addition to the use of antidepressants is better than either alone. And so I've got to believe, to your point, there's something around the idea of the patient having some sense and understanding that the way their brain is processing things is broken, for lack of a better word, and that this medication is intended to help snap them out of that state. And I think both together probably, I would think, would work much better than either one alone, potentially.
So is that true, Chris, for drugs like naltrexone that treat substance abuse? I've talked to many clinicians who they will tell me this drug is being used off-label to treat out-of-control sexual behaviors as well as maybe even alcoholism. Is that something that you're familiar with?
Yeah, so naltrexone is a medication that, if I remember correctly, is used to treat alcohol and opioid use disorder. And it has an impact on the opioid system, which is a set of neurotransmitters that we have in our brain And that we've also have medications that work on that system. So things like oxycodone and hydrocodone work on these opioids, and they're incredibly powerful at a changing brain chemistry. And so, to your question, I think there probably is involvement of that system in a lot of different compulsive or addictive behaviors. And so it's not entirely surprising that, yeah, if you have a medication that would act on that system, and that system is broadly involved with those types of behaviors, that it could be successful.
Now, Amanda, you treat addiction. You treat obsessive compulsive behaviors. I mean, you are in the weeds of all of this, and it's a well-known fact that a lot of clinicians like you will utilize naltrexone for an unfaithful spouse to curb their cravings towards an affair partner, right?
Yes. So an unfaithful spouse that might be going through detox, but also if you have infidelity combined with known compulsive sexual behavior, or, on the street, they're still saying sex addiction, then what we know is the naltrexone really can work on the impulse control and giving that client a better sense of peace where they're not constantly having to basically reach for the chocolate. It's the same, right? That's what I want my clients to think. It's reaching for chocolate or it's going for a drink. And so whatever it does to the brain, it calms it down so that it's not constantly energy is going towards just trying to stay sober, just trying to stay sober.
That's excellent. Now, you work with a ton of betrayed partners who have suffered from PTSD and complex PTSD due to their partner's unfaithfulness or addiction or what have you. Now, for points of clarity, what's the difference between complex PTSD and PTSD? And what are some markers that not only in betrayed partners, but sexual abuse survivors of complex PTSD?
So what we see is its age of onset for initial traumas to be happening. So if the brain from the childhood years where, from what I know, but Chris is the neuroscientist, so I have a very small understanding compared to his, the brain is in this really massive state of growth and like a sponge sucking everything in. So if you have a child that is going through childhood sexual abuse, or there's really severe neglect, or there's really horrible physical abuse, and this is over a long period of time in their developmental years, that's going to cause complex PTSD that's going to follow them into adulthood. Then let's say that they also experience betrayal trauma, then that is just going to blow the top off of all the abuse and neglect that they have incurred from childhood. Their brain is already basically what we see like at risk. Is that, Chris, would you agree with that?
Yeah, no, it's absolutely right. And I mean, to your point, these aren't just sort of feelings of stress or trauma that people have out in the ether. There's a real biological underpinning that's causing this. And we know, it's not just early in life. We know that in utero, when you expose in the laboratory pregnant female rodents to extreme stress, that the babies are affected later in life, despite the fact that they were never exposed to that stress. And the number of it does, the hippocampus, which is the kind of the part of your brain is responsible for consolidating memory. So there was a famous patient who had to have that part of his brain resected because it was causing severe epilepsy, and it stopped the epilepsy, but he could form no new memories. So that part of the brain, they've shown in some patients with PTSD, literally shrinks. That can happen to other part of the brain, where you can look at the brain on a gross level, and relative to a quote unquote normal control, there's these gross differences in the brain. We also know that our system of stress response, sort of epinephrine release. So that feeling you get if, you get a rush of adrenaline, right? Epinephrine and adrenaline can be used interchangeably. If, you're getting ready for a sporting event and you're feeling that rush, or you walk around the corner and somebody startles you and you get kind of that hyper jolt, that system gets sensitized in people with PTSD. So what that means is that whatever response should have happened, they're literally getting a jolt that is much, much bigger for any given stimulus than they would have gotten had, they not gone through that stress. So there's innumerable ways where that early PTSD literally rewires and reorganizes the brain. And we know that most of that development occurs early in childhood. And so when it's occurring in childhood, there's dramatic changes that we see.
So that's why we think that when we are getting betrayed spouses, that they automatically are going to have developmental trauma from childhood, because there are people that go through infidelity. They don't need to necessarily go through counseling. They don't have these huge psychotic breaks. I mean, like I did. And that's what was explained to me. Why am I having this reaction? But there are other people who are having this experience with the betrayal trauma, but they are not reacting the way that I am. And that's what my clinician explained to me. You have the developmental trauma, the complex PTSD. So that sensitization, when I get triggered, I have a $10,000 reaction, as opposed to someone who did not have developmental trauma from childhood. They have basically more resilience.
Is that why it might be helpful for an unfaithful to hear that, because they might be susceptible to the, unfortunately, ignorant belief that, well, my betrayed is just making a big deal out of nothing and they should just get over it and they should stop. Why are these having this big reactions? Why does he or she keep getting so mad? And why are they so just out of control? Maybe it's trauma, not just, as Chris alluded to, not just a bunch of emotions that are flowing through them, right?
So choice. So what Chris helps me understand is, okay, so if my clients are having this reaction, right, and the unfaithful spouse is like, they're just choosing to behave this way. They're choosing to be over the top or not calm down. And I go to Chris and I'm like, is this true? Because I'm watching these clients and I'm telling you, if they had a choice, they would gladly stop. And then Chris can explain, yes, their brains are not capable of it.
Yeah, I like to think of it as there's this kind of, everyone has a bar for like what sets them off, and you do have a choice of whether you let your response. You have some degree, I think, of, I don't know if I want to say control, influence over whether you go over that, but I like to think about it. The bar is so much lower for somebody that has a brain. When they had those old commercials in the 80s that say, this is your brain on drugs, and it showed the fried egg or whatever, more accurate would have been like a total rewiring of the brain. And that's what you're dealing with folks that have PTSD. And so that bar is way lower, so that any given input has a much higher likelihood of giving, that you said, that $10,000 response. And it is much harder for them to control it than it would be for someone who hadn't gone through that experience.
So the psychotropics can help give them back their dignity of choice, right? So Chris is saying they have choice kind of up until a certain point, and then once that point hits, it's the veteran that comes back from war and he's in a movie and a loud noise happens and he will kill everybody in the movie theater. There's no choice then. Okay, so the psychotropics try to give the betrayed spouse more choice so that they have more of a window of tolerance to pull back before they go, nuclear.
So, Chris, let me ask you a question. What are some common misconceptions that the general public has about the way the brain actually functions?
Yeah, there's a number, and I think that none of them were ever anybody, in my mind, acting in bad faith, trying to fool anybody about how the brain works. But it's sometimes useful to talk in analogies that people can understand. When I think about other fields that I don't have expertise in, analogies are quite useful in helping me understand concepts. I think the first one, that this idea that the brain is just a soup of neurotransmitters floating around, and that psychiatric and psychological conditions are due to an imbalance in neurotransmitters, I think has been pretty decisively proven to be false in most instances. It was useful because what happened was the drugs that we discovered very early on that help work for depression, the SSRIs, or selective serotonin reuptake inhibitors. Basically, one of the things they do is they stop uptake, or they help slow the uptake of serotonin into the neuron, and creating more serotonin, presumably like in systemic in the brain for to work on the neurons. The issue though is that the observation that they had antidepressant effects came before we understood the mechanism. And so I think the mechanism was almost like a post hoc rationalization, trying to say, okay, we know these have these antidepressant properties. And we figured out that this is one of the things these do. So this must be the problem with the disease. But depressed people don't have too low levels of serotonin. If that were the problem, it wouldn't take them 2 weeks in the bloodstream to work to build up the effect like they do. And so they do selectively inhibit serotonin uptake. It's not a soup of neurotransmitters and getting balance. The serotonin does a ton of things in terms of modulating how the brain rewires itself and wires itself, and there's probably something going on with that. I'm trying to think about some other ones. I do think what we just talked about, this idea that feelings are just feelings and that they're separate from the brain, whether people implicitly or explicitly believe that, is, I would argue, is false. I mean, we've just been talking about how we're discovering that all these issues that people with psychological diseases have, there's correlates. We can watch what's happening in the brain and how the brain is changing. Addicted individuals, those, whatever their addiction is, whether it's a substance, a behavior, that has literally rewired the brain to make them want to pursue that substance or that behavior at all costs. And so the idea that, we morally judge people for making poor choices because they're addicted is, I think, just patently false. Maybe it was a moral choice that they shouldn't have done the substance in the first place, but now their brain's rewired, and if we treat them as if they're a moral failure, that's not going to help anybody with anything. And so I think realizing that these things are, they're in the physical world, there are reasons that people are behaving that they do. So there's probably a few more, but those are two big ones, and I can stop there.
Well, and to you, Amanda, how does that show up in the lives of abuse survivors and even betrayed partners?
I know, even with unfaithfuls, one of the biggest shame buttons is trying to tell an unfaithful or a childhood sexual abuse survivor or a betrayed spouse that's triggered, well, you're just a piece of crap for how you're acting. You should just change. You just shouldn't have done it. You should just be different. You should have just been like so-and-so. Right? That feeling of being judged and being misunderstood. And, you just woke up one morning and you decided to ruin your own life and ruin everybody else's life. Like, people have, how would you explain, Chris, just the subconscious aspect of like those kind of driven behaviors? I try to explain to my clients, we think that our conscious mind is running the show. But what I've learned is that no, I don't even know what it means, the subconscious mind, like from a brain perspective, but we are doing a lot of behaviors and having a lot of reactions and feelings. It's driven by the subconscious part of the brain, whatever that means.
Yeah, no, I mean, I know there's probably different listeners with different beliefs, but, I take kind of an evolutionary thinking here where, human beings the brain has evolved. We have common ancestors with some of the animals that are around today, right? And we can see, there's common brain structures between us and a mouse. And it's the cortex, the wrinkly part, when you look at a brain, the wrinkly part on top that is way more developed in a human than it is in a mouse. But all the structures underneath we kind of share. And so if you think about like humans in the course of evolution, like most of the mammalian brain spent its time evolving those structures that you don't see when you just look at a brain, and that are shared amongst animals. And those are the structures that drive the things that we need to do to survive, right? So if we had to think about like literally consciously think about getting food, rather than it just being sort of this drive that our unconscious brain makes us do, like that's a survival mechanism. You don't have to waste time thinking about that. You just want the thing to be able to do it. Same with procreating, right? That's a very strong evolutionary drive that is in there. And I think what happens is that while these things have, I think they're there to help us as a species stay alive. the world we live in now is very different than the one that those structures evolved to optimize for, right? That didn't evolve in a world in which you can eat a donut every block of the way as you're walking down the street, right? And so someone that struggles with food cravings, or that evolved in a situation where, for procreation, there weren't, members of the opposite sex literally everywhere, or that you can pay for, to to have your pleasure with. That needed to be, when you found somebody to mate with back in the day, like, there's a good chance there might not be another person again. And so you had to make sure you mated with them. And then, drugs of abuse, the sort of insidious thing that they do is they co-opt these natural subconscious brain regions that drive that behavior. And the things that are the parts that are supposed to make us want sex and food and sleep, and the drugs of abuse actually literally hijack that circuitry to make the person want those drugs of abuse. And so the quote unquote unconscious is hugely impactful in how people go about behaving every day.
Well, and if your survival system gets hijacked growing up, we'll make some controversial statements. I'll make them today so you don't have to make them, Sam. So childhood sexual abuse survivors, one of the most difficult things to discuss is if we become compulsive with our sexuality, we can become compulsive. That can feel like a survival strategy, because intimacy was fused on our template is something that like almost killed us, right? It was abusive to us. Then you can become also sexually anorexic and totally shut down. And then that can cause your spouse to act out. And that can also be in your mind a matter of survival. If sex and intimacy, especially if you have a traditional like male and female relationship for men, which is hard for women to hear, but men are biologically brain built different when it comes to sex. If that's taken off the table for them, I mean, I feel like what I can see is that throws men into a survival confusion where, oh my gosh, like, and then they go and act outside of the marriage. So how everything kind of goes together, if the systems are getting messed up, then what the subconscious brain feels like needs to happen for survival can be very self-destructive.
It makes great sense. Go ahead, Chris.
No, I was just going to make the point too that I think, Amanda, and you would agree that we're not saying you can shirk all responsibility because your subconscious brain is driving is driving you towards certain behaviors, but rather that there's reasons that people have certain behaviors. And I think what we're trying to make the point is that these are incredibly powerful impulses, driven by areas of our brain that we not even aren't aware that's happening, and that it to heal and to do better, you need to kind of be aware that all this is going on.
Yeah, I bring it up because what's most common, Sam, with infidelity and betrayal trauma, it's you did this because you didn't love me. You did this because you wanted to leave me. You did this because you didn't want to be with me, or there was something wrong with me. So we have to help explain how that isn't true. So then the client has to learn how to introspect and go underneath the iceberg and really get into why in the world did I do these things that on the one hand, I do love my partner and I want to be with them, but I just acted out in ways that would say the opposite.
Well, and this is a good question for both of you, is why is substance addiction so difficult to treat, including being addicted to an affair partner or being addicted to porn?
Chris?
Yeah, no, I mean, I think so. The first principle is that the reward system in our brain, so that feeling of pleasure that we get, like I said earlier, is designed to motivate us to do things we were supposed to do to stay alive and to procreate. And it's a really, really powerful system. I mean, there's a classic experiment, you can probably YouTube it, where it's a part of the brain called the nucleus accumbens. And they put a little electrode into the head of a rat, and the electrode is inserted into the rat's nucleus accumbens, which is one of these kind of subcortical brain structures. And the electrode is hooked up to a lever in the rat's cage, and the rat can push the lever as much as it wants. And what ends up happening is that this rat ends up dying because it spends all its time pushing this lever and forgoes food and drink. And
Wow.
so substances of abuse, whether it's cocaine, opioids, alcohol, any addictive substance, and then I also suspect addictive behaviors have that exact same effect where they are literally acting on that reward circuitry and they're rewiring that circuitry to cause the individual or the animal to want to pursue that sort of reward at the cost of everything. I mean, that's why I lived on the West Coast for a little bit, and it's really sad to see the homeless situation there. But that's why you see people whose lives are shattered, and they're doing everything they can to get their next hit of drug, and they'll starve to death because that is how powerful those substances are at changing and acting on the brain's reward system.
And Amanda, in your caseload, you've been treating sexual addiction, childhood sexual abuse survivors for quite some time. Would you say that's what you see on a daily basis, is people learning and I guess coming to the realization you can't just white knuckle this. You can't just turn this off. You can't just think that, oh, I'm going to read a couple of books and I'm just going to be good to go, right?
Right. I say if that is what's going to work for you, you wouldn't be sitting in my office. You wouldn't have had all these choices over all these years. You're basically then admitting to me that every time you acted out in a destructive way, you wanted that. And then they freak out. No, no, no. I said, okay. So what we then look for is what is the original source of pain that then caused you to latch on to that behavior for dear life. And I don't know, Chris, if you can speak to that, but that's always what I'm looking for. So back to a childhood sexual abuse survivor, or even if you have an unfaithful spouse that has a childhood history of emotional neglect, really horrific physical neglect. If they have a partner that they perceive as abandons them, that causes pain. Okay. And then they could go and have an affair. A childhood sexual abuse survivor, sex in a relationship where there's also intimacy can become really scary. And then we need to go out and we'll self-medicate or we'll trauma reenact. But it's the original source of pain that then is what we see. You're latching on to those pleasure systems. The homeless population, I would be running around making them all tell me about their childhoods.
Yeah, no, I would agree with that. I'd say there's probably also an element just too of individual differences there, right? Where, that's why I'd like to think about it as a bar. Like even people that haven't had trauma that I know of in my life, some people are just better at postponing, delayed gratification, postponing pleasure, right? Just at a baseline level. And then, yeah, you add on the trauma piece to that and, pleasure, it maybe lowers the bar for, needing or not wanting pleasure, not being able to delay the gratification because you had this horrific thing happen and you want to do anything you can to kind of avoid it and feel better about it. Yeah.
I think that's a great point. And for those of you that are watching and listening, especially you that struggle with compulsive behaviors, on behalf of obviously Chris and Amanda and certainly myself, there is a way for you to get healthy. You may have tried several different things and it has not worked. But I will tell you, I have seen people find healing and find sobriety time and time again. For the sake of time, I know I can speak for Amanda that time and time again, we see couples and individuals heal from compulsive behaviors and complex PTSD. There is a way to get your life back. So, Amanda, as just kind of a final thought for those that are out there and maybe unfaithful, but particularly betrayed, who are dealing with PTSD or complex PTSD, who feel like, am I ever going to get my life back? Am I ever going to find a sense of joy, purpose, and meaning ever again? What would you say to them?
That it's all about not giving up. So you don't give up and you find people to continue to add to your team. So we work in big teams. When you're dealing with complex PTSD, betrayal trauma, compulsive behavior, childhood sexual abuse, you have a big team. So it doesn't mean that just because, and Chris would say, just because Prozac doesn't work for you, it doesn't mean that ketamine won't. It doesn't mean that naltrexone won't, or Lexapro won't, or whatever ETT or EMDR. So you just keep trying and you keep finding specialists to add to your team, and it's one step at a time, and you invest in yourself. You have to believe that you're worth investing in.
Well, I think it's a beautiful statement, and we have to invest in our own healing. Without that, you just can't stuff it down and you can't suck it up and just move on. I wish it was possible. I really do, but it's just not. So, Chris, thank you for coming in and for sharing so much information with us. Amanda, as always, thank you for coming in. If you would like to pursue help from Amanda, if you are struggling with complex PTSD or just PTSD or compulsive behaviors of any kind, Amanda, what's the best way for them to reach you?
To email me at amanda@healingaffairscounseling.com.
If I can be of service, you can reach me at samshealingpodcast@gmail.com. You can also leave a comment here. I'd love for you to like and subscribe. We will see you next time on Sam's Healing Podcast.